Quezon City Medical Society. What keeps you going? It's easy to say, keep your chin up. But in times of pandemic, when the situation seems hopeless, when you're exhausted, hungry, and overwhelmed, what keeps you going? COVID-19 has disrupted every aspect of our lives for the past 4 months. Our social lives, livelihood, mobility, and most especially, our physical and mental health. Much of the plans that we had for this year has gone out the window. For instance, the 36th year convention we were planning for last June, as passionate as we are for learning. This would have been our main avenue to share our knowledge and to learn from each other. Then there's also our planned grand celebration for our society's 70th founding anniversary. Planned medical missions, feeding programs, and outreach programs. As much as we would have wanted to continue them, everything came to a standstill. It was as if someone pushed the pause button. But like the rest of the industry, we chose to find ways. We may not be able to see each other face to face, but we continue to build our plans for the future. And like what we're doing right now, to celebrate our success right here in the virtual space. What are the challenges of doctors during this pandemic? We've been hearing news of our comrades, medical frontliners as they are called, being infected by this disease and some succumbing to it. This has indeed been a challenging year not just for QCMS, not just to the medical industry, but to everyone across the globe. Our patients too can feel, at times, trapped between the possibilities and the reality of the situation. Some of us have had to temporarily halt our practice. Being unable to open our clinics mean our source of income has also been cut off. It's a blessing if you have some savings, but even that won't last for long. To open our clinics again, we need to spend some cash to ensure that proper safety equipment and gears are in place. Fear. This is the thing which we need to overcome the most. The fear of being infected, the fear of infecting our loved ones, and the fear of what would happen once we got infected. Amidst this fear, though, there is hope. There is a means for us to continue, to survive. We may have been crippled, but we were not totally immobilized. Through prayers and positive words from each other, we get encouragement and strength. QCMS projection for the next 5 years. Within 5 years, we must continue to adapt to the flow of a new standard of healthcare. This new challenge we will face head-on. Seizing our chance, we have the opportunity to bounce back. In this time, we can further studies to develop new, more effective methods of treatment for patients. We can change the way Medicare works through advancements in technology to provide a smoother, contact-free way of keeping appointments. We can work on ways to provide more accessible essential services to remote areas in the Philippines, strengthen our operational logistics. We must speak the truth with kindness and wisdom, and keep pressing onwards towards the brighter future we can create. Let us continue to give hope. We are very proud that we have reached this 70 years, and we hope that we'll continuously have society members who are willing and able to carry our vision and mission. Our society's SEC registration is still good for another 50 years. We renewed our registration last 2015. If you add another 50 years to that, the society will still be around until 2065. We are still unsure of how long this pandemic will last, or what the new normal would look like. But one thing remains to be clear. Our priority for now is to survive until such time that the infection has died down, or when the vaccine has already been developed. As individuals, as medical practitioners, as a society, we owe this much to ourselves, to our family, to our fellow medical practitioners, to our society, and most importantly, To our patients who are waiting to see the signs on our doors, say, "The doctor is in."